Hello, I'm Dr. Robert Graw, founder of Righttime Medical Care, and this is your apple per day. Spring is here, and sports injuries are not far behind. Sports injuries can occur and involve any part of the body, depending on the age of the participant, and now we're having older people up to 80, 90 years old fully participating in sports. Any part of those fragile bodies can be injured, starting with the head, which is obviously the part we worry about the most, and we'll talk about under the case of concussions, and the extremities, which are always very vulnerable if not protected. You also can have oral, ocular, nasal injuries, neck injuries, rib injuries, abdominal injuries. Each of these occur probably because of an inappropriate activity during the sport. When you have competitive sports and there's another player trying to get the advantage, it's possible that your body may take the fall. In preparation for sports, it's important that your body be in the best of shape. So how do you know if you have a sports injury? Well, when you're out there on the field or on the court for the first time after a long winter's rest and we haven't sufficiently prepared, and you get pain and or swelling, there's a good chance that we've bruised and or stretched some part of our body to an abnormal position. The most important part to recognize is that if it hurts, it should not be used. So if an injury occurs and there is a bruise or a painful contusion or a stretch, stop the exercise and assess whether you can continue. So after that initial evaluation where you've self-diagnosed whether there's a bruise or swelling or pain and it's not getting better and you've given it plenty of rest, you need to see a provider. A physician is the only person who can finally assess, perhaps through physical examination or through x-ray studies, whether or not a joint or some other part of your body, God forbid your head, has been injured as a result of a sports injury. So in summary, the most important first response is rest, immobilization, pressure, apply cold ice, and use only sparingly pain medicine until further evaluation of the injury can be obtained. One category of sports injury which we discussed in detail this winter was concussion. Concussions can occur during the spring and summer as well, particularly in those sports where we don't prepare ourselves wearing those special helmets, such as in lacrosse or baseball. Make sure you have a helmet that fits well, make sure you understand the signs of concussion, review the video that we prepared before that analyzes exactly the symptoms that you should be concerned about, and most importantly, the information regarding the IMPACT impact studies. This has been your Apple Per Day. Thanks for joining me. Stay healthy.